New at 11, an ABC 27 investigation has healthcare officials warning of the dangers of liposuction. Tonight, the president of Florida's medical board warns that popular cosmetic procedure is even more dangerous than what your doctor may be telling you. Katie LeGrone shows us why.
She said that she wanted to lose 10 pounds.
Michael Lawn's mom.
She didn't have to lose the 10 pounds.
Cecil Carmichael's bride.
She wanted to get rid of the fat.
Of 46 years. They are family members still reeling from losing their loved ones to liposuction.
It was just a simple procedure, 3 hours, then you go home and go back to work in 3 or 4 days.
The second most common cosmetic procedure in the U.S., liposuction uses specialized equipment to suction out fat. And while the complication rate hovers around 5% nationwide, we've discovered this slimmed-down surgery is resulting in an uptick of deaths and injuries.
You said you don't know why this happened.
Including right here in Florida.
That's how these patients are dying.
Forcing warnings from the state's top doctors.
I am concerned about the significant number of deaths that we've seen at the board just this past year.
Carol Nadeau was 67 years old when she underwent liposuction at an outpatient clinic in Central Florida. Within a week, she was in the ER with a punctured colon, septic shock, and renal failure.
When I saw her for the first time in the hospital, I was pissed.
A few months later, after more ER visits, surgeries, and a stroke, Carol died. State discipline records and a malpractice suit blame the heart doctor who performed her liposuction.
I mean, he's a heart doctor. Why is he doing liposuction?
Turns out there's no law limiting licensed doctors from doing certain procedures, even if they're not trained or certified to do them.
State records also reveal Carol's doctor was board certified in internal medicine and cardiovascular medicine, but his training in liposuction, a 2-day proctorship.
When it comes to who is qualified to do procedures, the Board of Medicine unfortunately, has our hands tied.
Dr. Stephen Rosenberg leads the state board that disciplines Florida doctors who do wrong.
This patient had serious complications.
He said liposuction has become one of his top concerns.
I think you're seeing more and more individuals who are inadequately trained doing these procedures.
This year alone, the board has disciplined nearly a half-dozen doctors for liposuctions that contributed to a patient injury or death.
Typically, they'll say they took a weekend course and had complications.
Have you been trained in the complications of liposuction?
Yes, sir, of course.
The Southwest Florida family doctor was recently fined nearly $25,000 and banned from all surgeries after a liposuction patient became infected. He says it was the result of the patient's own wound care. When asked about his liposuction training, he told us a few days at a Texas seminar.
But do you think that that's adequate to then do liposuction on patients?
It is minor, no anesthesia.
Here we have a case where the patient goes in for a cosmetic procedure and dies.
But we found even experienced doctors in lipo are getting it wrong.
That alone, I find disturbing.
This doctor told the board he had thousands of liposuctions under his belt before he punctured 63-year-old Rhonda Carmichael's bowels multiple times.
I just couldn't believe it.
She died less than 2 days later.
Doctor says she's gone.
How do you get into your abdominal cavity when you're doing liposuction?
Seated next to his attorney, the doctor didn't have an answer. But in this lawsuit, the family's lawyer said he should have known Rhonda, a diabetic with multiple health issues, was not a suitable candidate for the procedure. The doctor settled with the family and agreed to pay the state $30,000.
This past July, we would have been married 51 years.
Both families want the state to do more to protect patients from a popular cosmetic procedure in Florida and its dangerously ugly side.
People say, well, forgive and forget. I don't, and I haven't, and I can't.
Katie LeGrone, WTXL, ABC 27.
The American Board of Cosmetic Surgery describes liposuction as a safe procedure, but recommends patients only go to a qualified cosmetic surgeon.